Hemodialysis is the lifeline of a kidney patient. Over the last 50 years, dialysis procedure has evolved significantly from very basic, big, large units to compact dialysis machines, which can perform several functions. And not only performing several functions, they also measure the electrolytes as well as hematocrit, and are so intelligent that they can modify the dialysis procedure as they go along. Um, I'm going to be showing you a hemodialysis machine, how it works, the various disposables which are used in the running of a dialysis machine, and then in further videos, then we'll see how the dialysis machine is set up, how it is primed, and then further on, then we'll actually take you live to the patients. We'll see how the various vascular access are accessed, and what are the complications which you can see during a dialysis procedure. So what I've got here is a hemodialysis machine. It's a Fresenius 5008 dialysis machine. And what we have to remember, the hemodialysis procedure, it entails three segments. One is the patient segment, that is the patient. The other one is the dialysis machine, and the third one is the water treatment plant. Now, dialysis basically means clearance or cleansing. The normal kidneys perform the same function as a dialysis machine does, but obviously it's highly sophisticated. Regular dialysis performs just hardly 20% of what the normal kidney does, and that's 20% clearance of what the normal kidney can do. But nevertheless, that is sometimes it is enough to maintain a reasonably healthy quality of life. So when I'm saying the three important segments for a successful dialysis procedure, we have to make sure that these three segments they're working in harmony, they're working properly. The patient factor, if the patient is too ill, obviously you won't get the results what you would expect from a dialysis procedure. And likewise, if you've got problems with the machine, or the machines are outdated, or the equipment which you're using, the disposables which you're using are not up to date, then you will not get the desired results. And the third most important component is, which is usually and often overlooked, is the water treatment part. What you will see here is a patient or a dialysis machine. What you won't see is a water treatment plant. The water treatment plant is way at the back, but that's critical. It's extremely important because this is the water which actually goes inside the patient. And so therefore that water, it has to be of a very high quality, and because it goes in, we have to make sure that it is sterile as well. So coming back to the dialysis machine, you'll get a monitor which actually shows you all the various functions, and then down here you've got the different parts. All the dialysis machines now, they'll be marked red and blue. Red means the artery, and the blue means the venous part. But the red and blue are important when it comes to these sections, and that's where the blood tubing line it goes in. These are the pumps, and these will make sure that the blood flows properly through the circulation. Here, up here, we've got the heparin pump, we've got the various sensors which are located in the machine. And in a minute, I will turn this machine on, and I'll show you how this machine actually works. But first, let me show you a few other things, and that is, think about the dialysis disposables. Now, what you need is, you need a vascular access. You need somehow to access the blood. Either that is in the form of dialysis catheter, like a permanent dialysis catheter, or by means of an arteriovenous fistula or arteriovenous graft. And you can access the graft by different needles, and these needles are of different sizes. It's just like you get a Foley's catheter, or you get an IV Venflon. That these are of different sizes, and the sizes are there for the particular patient. So for instance, if there is a younger patient who's got small blood vessels, you wouldn't use a very large needle, because in that way you can counterpuncture that vascular access, and so on and so forth. But if there is a large patient, you won't use a smaller needle, because then you won't get the desired blood flow which you need, because the bore of the needle is important when you're dialyzing. So you need to take all of those things into consideration. So what here I've got here is, these are the different dialyzers which we use, also called as the filters. Here I've got the bicarbonate solution, and I'm going to talk to you about that in a minute. Here we've got the fistula needles, and then we've got the different blood tubing lines. We've got the IV drip sets, the needles, normal saline, a packet of gauze, and we've got gloves. Remember, the gloves are extremely important. They have to be used with every session, and you can use multiple gloves in order to prevent cross infection. Now, these are fairly basic. The reason why we use normal saline, because normal saline is isotonic, and this being isotonic, it means that it doesn't really change much as far as the concentration in blood is concerned. In some situations, you can use dextrose water in those patients who become quickly hypoglycemic. So you can prime them with dextrose water, but normally the priming fluid, which is used as standard priming fluid, is a normal saline, which is 0.9% weight by volume. So once you've primed the machine, and when we say priming of the machine is that this saline goes into the blood tubing line and the dialyzer, and this is called as priming or the priming fluid. The approximately amount of priming fluid is about 200 to 300 ml. It depends really on the size of your blood tubing line and the dialyzer, but it's about roughly between 200 to 300 ml. But the important thing about saline is that when you use saline as a priming fluid, we tend to hang it up as well, which you'll see here in a minute, like on the dialysis machine, you'll see those the IV hangers. If the patient becomes hypotensive during dialysis, so this is the fluid which will immediately bring the blood pressure up, and that's why we use normal saline in place of all the other ones, because they will not help if somebody becomes quickly hypotensive. And that's one thing. One of the major complications of dialysis is the hypotension. It remains there. The syringes, once again, there are different syringes. You've got the 5cc syringes, which obviously have a blue needle, and then you've got the 10cc syringes, you've got a green needle. The needles are interchangeable. It depends really, it's your preference. It doesn't matter which ones to use, but you need several of them during a dialysis session. So this is a standard IV drip set, which is required for this. There is nothing special about it. But coming here, now these are the important ones. Here are the blood tubing lines. This particular blood tubing line, if you can see that this is different from these ones, this is a universal blood tubing line. And when I say a universal one, this can fit on virtually most of the dialysis machines which are available in the market. This is, if you read here at the back, this is 4008. That means for Fresenius 4008 machine, which is one of the older models of Fresenius dialysis machines. But this actually takes up this particular blood tubing line, but this can be used on virtually all of the other models of dialysis machines, which are made by different manufacturers. But as I've said, sometimes you get a different one. Now, when you read a blood tubing line, you'll often see that there are certain things actually they're written at the back. You'll see that there is a drip set. You'll see where it is made from. Then you'll see the date that it was manufactured, and you'll see all of that. And then you'll see something here as well. You see that this is a 22 millimeter one, and this is what it is, that it actually goes around the pump and what kind of pump speed that it will take. So this actually maximum, that's for 12 hours. So you can see different, you can read a lot actually about this particular blood tubing line. This one is a specific blood tubing line. This is for the Fresenius 508 machine blood tubing line. And so it says here is 5008R. Once again, you've got the manufacturing date, you've got the expiry date at the back, and plus you've actually got the diameter. So this is an 8 millimeter blood tubing line. And 8 millimeter lines these are larger in caliber. So because they're larger in caliber, you will actually get more clearance from these machines, from these blood tubing lines, because the blood has to flow through it. So it's important that before you actually proceed, if you're using a universal one, you need to see what the size, what the diameter of these machines is. So this one is a 12 millimeter one, if you see that. So this is a 12 mm one. This one is an 8 mm one. So it really depends on what the clearance is as far as these machines are concerned. Now we've got the fistula needles. The fistula needles are sometimes they are marked red and blue. The blue stands for venous, the red stands for artery. There are three systems in which red and blue interchanges. Normally we know that there is a a blue which stands for venous, and there is a red which stands for artery. But there are three areas where blue and red they are the opposite. That means the blue, it carries the oxygenated, as we say, the good blood, and the red one carries the bad blood. One of them is in the lungs, where the pulmonary artery and the pulmonary veins, so they interchange. So therefore, the deoxygenated blood is in the pulmonary artery, and the oxygenated one is in the pulmonary vein. This is in contrast to the rest of the body. The second one is the placenta, and the third one is this one. So for those people who are going to say their fellowships or membership examinations, remember that this is a very important thing, that these are three areas where the artery and veins, they are different. So as far as dialysis machine is concerned, it's the same thing. The blue one, which is normally venous, it actually stands for the good blood, or the oxygenated, or the better blood, and the red one, it stands for the bad blood, which means the blood which is not clean, not clear. But these needles, I'll just show you in a minute. I'm going to open up a needle here, and if you look closely at this particular needle, what you'll see here is that there is a bore at the back. I hope you can see that. So there is one at the top, and there is a bore at the back. Now, this is in contrast to this particular one. This is the other one. That is the blue one. And here you won't see that bore at the back. In the first one, you saw the bore at the back. In the second one, you did not see the bore at the back. Now, there is a huge difference when it comes to bore. When you are using this particular needle, this will take on more blood. So therefore, this is the needle which you are going to take when you want to draw blood. So you'll take on more blood. If you use this on the other side, that means if you use it as a return needle, you're going to puncture, because the amount of blood going will actually be too great, and so this is going to puncture, or it is going to damage the blood vessel or the fistula. So if you get a needle which is this one, which has a double bore, one at the back, one at the top, this is for drawing excessive amount of blood, and this is better when you're actually drawing blood from the patient and going into the machine. So this is very important, but there are lots and lots of these needles which are available in the market which do not have this bore. But if you've got this bore, then this is a very good quality needle, because it will give you better results when it comes to dialysis. So these needles also come in different sizes. So they've got you've got 17 gauge needles, 18 gauge, 19 gauge needles, and if you've got a 17 gauge needle, it means that the bore is small. If the bore is small, this is for a smaller fistulas, this is for a smaller graft where you don't want it to be counterpunctured. If you've got if you want more blood flows to coming in, then you need a higher gauge needle. Like usually we use an 18 gauge needle. So 17 gauge needles are usually used when the access is to start, when you want to start dialysis on a new formed access where the vein is a bit fragile, the vein isn't really formed, it's not fibrosis yet, that the wall isn't very thick, and that's where you use a 17 gauge needle. So the first needle which you use when you initially start a fistula is a 17 gauge needle, and as you work up, as the fistula matures more and more, then you can go on a higher gauge needle, because you need to draw in more blood. The smaller needle will draw less blood, the bigger needle will draw more blood, and so therefore there will be more clearance with that. The next one is the bicarb solution. Now this is very important, because this is actually what mixes in the machine. So the bicarb mixes in the machine, and this is what goes inside. The patient clears, the patient's blood is cleaned, and fresh things go in. Now this is a standard bicarb for a single machine, for a single unit. This is usually mixed with something called as an A part or an acid part, because on its own it doesn't work. So it has to be mixed with an acid. But here what I've got is what we called as a bibag, and this is a bibag, it's a Fresenius bibag. This attaches to it, and then you need an A part anyway. So what an A part is, this is called as a B part. B part is basic part. A stands for the acid part. Machines require an acid and an alkali. And because they require an acid and alkali, it's changed into carbonic acid. Carbonic acid is broken down again in the liver, and then it breaks down into hydrogen and bicarb, and so then you get a decent amount of bicarb. But remember, this is actually what it says here is that this is sodium bicarb. This is NaHCO3. So this is sodium bicarbonate. And sodium bicarbonate, you have to remember, when somebody becomes hypertensive during dialysis, remember you're giving them sodium. So if they become breathless, if they become hypertensive, if they've got volume related problems, and you can't just figure out what's happening with them, remember we are giving them sodium bicarbonate inside their blood, directly inside the blood. And so therefore then you'll have to go into the settings of the machine to bring the bicarb down, how much bicarb you want to give, reduce the amount of bicarb, and that will hopefully help your healthy hypertension or the fluid problems in these machines. Now this bicarb, it's normally added with this one. This is an A part, what we call. So this is an acid part, and the acid part in itself, it has got different numbers here. So for any dialysis machine, in any dialysis procedure, you need to look at these ones. You can get some low calcium fluids, you can get some high calcium fluids, you can get some low potassium fluids. But remember, with a low potassium fluid, you will not get a zero potassium, because if you go to zero potassium, by simple diffusion, the body will lose all of its potassium or most of its potassium, and the person can go to arrhythmias. So even with a low potassium fluid, you will have some potassium in it. You can never get a zero potassium fluid, because then obviously that is going to cause cardiac arrhythmias. But a low potassium bath is going to be it will have less potassium in it. So you've got different numbers here, and there are a few readings here, and they tell you what are the things in this one, because remember, this has to mix with this. So they're together. In this packet, we've only got bicarb. In this packet, we've got acid. The acid has got different things in it. So you've got calcium in it, you've got potassium in it, you've obviously got sugar in it. You need sugar in order to maintain an osmolality. If you don't have any sugar, the person will become hypoglycemic. Another important thing to remember is, in a dialysis session, 60% of blood sugar fluctuates. So you can lose 60% of your blood sugar. It's just a matter of simple diffusions. Things will move from a higher concentration to a lower concentration. If somebody's got a blood sugar of, say, for instance, like 200 blood sugar, and you're not you haven't got any sugar on the opposite side. So when this person is going to be connected to a dialysis machine, the person will lose that sugar, because it's a matter of simple diffusion from a higher concentration to a lower concentration. So the 200 blood sugar will drop down if you haven't got anything to counterbalance that on the opposite side, and that is, with your A part. So it will fall down. When it falls down, the person will become hypoglycemic, and that's one of the problems. Hypoglycemia is a major problem in dialysis patients because of fluctuations. So all of your dialysis solutions, the A parts, contain everything that the person needs. They have sugar. They have to have sugar. You can add in more sugar, you can add in artificially more sugar, you can get concentrates which have got more sugar in it, but it has to have sugar. It has to have sodium in it, because sodium is required for blood pressure. Once again, matter of simple diffusion. You don't have any sodium on the opposite side, the blood is going to lose simple diffusion. By simple diffusion, all the sodium, the person is going to collapse within the first hour of dialysis. So you need to maintain a certain amount of sodium. So this contains sodium, this contains chloride, obviously. This contains calcium, once again, very critical calcium, because calcium is going to drop by simple diffusion. And then this also contains sugar, and it contains potassium. So this part contains 5 different essential ingredients of varying concentrations. The rest, how much you want things to go in, how much you want to plan, the rest is done by the dialysis machine, which you program. So it's quite technical, but it's very important to understand. So you can never get a zero dialysis, a zero sugar bath. You can never get a zero potassium bath, because then obviously that will be detrimental. And this mixes with this. So always read the label, always read what says here and how much concentration is going in, and this has to be it has to be planned, it has to be designed. Every dialysis session is designed. It's a custom-made dialysis session. It's not like one session fits all. In most of the dialysis units, we get a central delivery system in which the bicarb isn't available as such, but there is a bicarb which is made elsewhere, and then that is delivered inside the dialysis unit, and so it goes in. So that's So that's another thing. Either you've got a central delivery system, and if you don't have a central bicarb delivery system, no worries. you will have these ones, and you just have to make sure that you read the label, what the concentration is in here. Lastly is the dialyzer as such. Now, when you see a dialyzer, you'll see them that there are of different sizes. They're more or less of the same length, but they're different of different breadths. And the dialyzer, it says you a lot. Now, if you read the dialyzer, you'll see that this is a polyflux dialyzer, it's a capillary dialyzer, and so it tells you a lot. It tells you about the size of this one. So this is a 1.7 dialyzer, and what this really is, what the meaning is, 1.3, 1.4, 1.7, 1.6, the meaning of these ones is that this is the surface area of the dialyzer membrane. For obvious reasons, if you've got a larger surface area, you tend to get more clearance. If you've got a smaller surface area, you'll get less clearance. So if you've got somebody who's big and bulky and he needs more and more clearance, you can use a larger surface area dialyzers as compared to smaller surface area dialyzers. This one is a 1.4 dialyzer. Obviously, this is not intended for somebody who's big. So if somebody is, for instance, if there's a 65-year-old woman who's of a thin frame, she's petite, you don't want to use a bigger dialyzer, because otherwise she'll feel extremely weak at the end of dialysis. Because these, when there is clearance, there is loss of lots and lots of good things as well during dialysis. You can't stop that. It's just part and parcel of it, because it's simple diffusion. And so therefore, this one is meant for those who are big and bulky. You want to use it for a short while, but these ones are the ones, for example, for younger patients, for people who are elderly, they're petite. You don't really want huge amounts of clearance. You just want a bit of clearance, but not a huge amount of clearance, and so you can use these ones. So these are, as I've said, these are different ones. They have got an FX10 dialyzer, so they are different kinds. So this is a 1.8 dialyzer, surface area dialyzer. So if they've got a larger surface area, either they'll be big in width, or they'll be a bit high, but this basically means that what you're using. So before you start treatment for every patient, remember, as I said, it's a custom fit procedure. One size doesn't fit all. Please make sure that your needles are appropriate, what you want to use in that particular patient. Like if you want phosphate clearance, you can get phosphate clearance by using a bigger size dialyzer. If you just want to clear the potassium, you can clear that with a smaller dialyzer as well as an ordinary needle. So it's something different. But if somebody is chronically hyperkalemic, you would want to make sure that the potassium bath is low. Although studies have shown that probably doesn't really make a difference whether you get a low potassium bath dialysate, or you get a normal potassium bath dialysate. Potassium is something totally different. But that's what. So you need to make sure that you've got the right blood tubing line, the right dialyzer. For example, if somebody required a 1.8 dialyzer, they may not require a 1.8 in future. They may require perhaps a 1.4 or a 1.31, and so that's how you have to make sure that you use the right disposables for every dialysis session. Thank you.